More than a century ago, Henri Tissier, a pediatrician working at Pasteur Institute in Paris who isolated Bifidobacterium for the first time, postulated that the baby was sterile in utero and that the colonization by the microbiota started at birth during the journey down through the birth canal. It was called the sterile worm concept. Over the last years, this paradigm has been debated, some researchers arguing for the presence of bugs in utero and talking about the placental microbiome, others claiming for contamination or technical errors. However, the recent published papers seem to put an end at this controversy and definitively validate the sterile worm concept. It is noteworthy, however, that although the fetus is in a sterile environment, it is exposed to its mother microbiome metabolites, which may influence its development. Thus, colonization starts at birth and is influenced by several factors, including the birth process, whether the baby is born by natural route or by C-section, the birth environment or place of birth, the exposition to drugs, including, of course, antibiotics, but also other drugs such as PPI. The time and mode of weaning is also important. It is important to consider that the colonization process is made in parallel to the maturation of the baby immune system, leading to a symbiosis. And epidemiological as well as animal models revealed that modification of this natural process of colonization was linked with risk of diseases in adulthood, including allergies and asthma, inflammatory bowel diseases, obesity and diabetes. This reinforced the so-called DOAD concept, the developmental origin of health and diseases that has been proposed by David Barker. So what can we do? Of course, we should advise a mother to breastfeed as much as possible. Indeed, the milk provides several factors, including immunoglobulin A, specific carbohydrates named HMO for human milk oligosaccharides that stimulate the growth of beneficial microbes such as Bifidobacterium, but also the milk is composed of a specific microbiota. Addition of prebiotic to formula, and why not this HMO, or the use of probiotics can be ways to influence microbiota colonization, maturation of the immune system, and to prevent risk of diseases. But not all probiotics are equal, and clinical studies are needed to document or confirm the expected effects.